Got it. James Meyer, Senior Medical Director at Marathon Pharmaceuticals. Been with the company for about 3 years now, and I kind of run the medical science liaison team, medical information, grants, IITs, publications. So, now we're ramping up for approval, and it's been exciting building out the infrastructure and getting ready for a launch. But this is one of the posters that was accepted at CNS this year. This is actually an encore from another conference earlier on in the year. Essentially, this is a post hoc analysis of our pivotal study. So it's what we used as our phase 3. It was a study that was done in the mid-90s by Michael Brook. It was originally sponsored by another company, and they walked away from it. And thankfully, the authors held on to that data and finished off the study. It was kind of lost to time. We always call it the Indiana Jones and the, packed away in crates somewhere in a warehouse, and our clinical team actually uncovered it. And so we got all the files together and all the data, reanalyzed it, and submitted that for approval. So what this is actually a post hoc analysis of what that trial is. There were actually a number of patients that had already lost ambulation within the context of the trial, about 45 of them. And so with those, we looked at some of the pulmonary endpoints that were collected within the course of the study. Yeah, so here in Figure 2, we show that the study met its primary endpoint and demonstrated that both doses of delfazacort and prednisone were superior to placebo at week 12, which was the primary. And then it extends out through week 52, where each of the groups that were in the placebo arm were re-randomized to one of the active treatments. And what we do see at week 52 is that there was separation between the delfazacort groups and prednisone group, which was actually significant for the 0.9 mg per kg per day, which actually was lower than the higher dose arm, which is 1.2. So for the 45 patients that had lost ambulation prior to randomization, we have table 1 down here with the baseline demographics. Everything is pretty well balanced out as far as age, weight, and height, and the baseline average muscle strength score, and pretty similar across the board for FVC and MVV for baseline values. So in Figure 3, we see that the change in FVC versus placebo and prednisone at weeks 12 and week 52, we actually showed a positive numerical improvement for both dose arms of delfazacort and a slight worsening for placebo as well as prednisone. And the same thing goes for the percent predicted FVC as well. And now moving on to Figure 4, we show the change in MVV versus placebo and prednisone with similar trends of a numerical improvement for delfazacort arm and then slight worsening for prednisone placebo. And so then we basically did a reanalysis of those data sets and looked at the change in FVC over time, where you can kind of see similar. I think this is a little bit more of a data anomaly that's happening with that drop that's happening at week 6 and week 12. But you do see pretty stable levels and slight increases numerically over time over the course of 52 weeks for change in FVC over time, as well as percent predicted FVC. We found it interesting that we saw improvements over time, is that this is setting up another study that we're planning on doing, which is the 061 study, we're calling it, which is focused on non-ambulatory boys, looking at pulmonary endpoints as the primary. We're also rolling in cardiac endpoints as well. And really, it's the non-ambulatory population is a not really tapped into population from a clinical trial perspective, and we would like to do a really well-designed prospective trial that captures that data. So this was kind of the post hoc analysis that set up the trend analysis to support looking into those data points.